Fecal egg counts are an important part of worm management in horses. In order to use your dewormers effectively, you need to know what types of worms your horses have and how many eggs they're shedding into your pasture. In order to perform a fecal egg count, a fresh ball of manure is collected in an airtight container and delivered to the lab within 2 to 3 days. Once in the lab, 4 grams of manure is weighed out and mixed with 26 mils of flotation solution. That mixture is put through a sieve and then placed on a specialized McMaster egg slide. On this slide, we can count the number of eggs that we see. Because we know exactly how much manure and how much solution has been mixed together, we can use the number of eggs on the slide to estimate the number of eggs per gram in manure of your horse. It's important to note that this number is not the number of total worms that your horse has, rather the number of eggs in just 1 gram of feces. So you can imagine that the number of eggs in your horse in total is much, much larger, and this gives us a good estimation of how many adult worms are present in your horse. The report the lab generates will tell you the number of eggs per gram of both the strongylid and ascarid worm types. It's important to note that there are some important worms in horses that don't show up on fecal egg counts, such as tapeworms and bots. Once you have the fecal egg count number, you can classify your horse into one of 3 categories. Low shedders, who have less than 200 eggs per gram, have a relative resistance to parasites and are less likely to have parasites and become ill. They also are less likely to contaminate your pastures. These horses can be wormed less frequently than some of your others. Medium shedders have between 200 and 500 eggs per gram. And the high shedders, who have over 500 eggs per gram, are the horses that are at the highest risk of having parasite-related disease. These horses are also responsible for 80% of the contaminated eggs that you find on your pasture that could reinfect those horses as well as the other horses on your property. These horses need to be tested and treated much more frequently. Once you receive the report from the lab, you can discuss with your veterinarian or your VRBAC area manager to interpret the results. Then you can use the VRBAC instructional wheel to help pick the right product at the right time of year.